In terms of looking at her, she was very obstructed into left rotation, 75, 80% loss of motion, doesn't look up, doesn't look down, doesn't look to the right. I mean, she just didn't want to move.
Yeah.
So at that point, I began with just mid-range retraction. I'm just trying to get some movement into the system to see if we can start to lessen pain and improve mobility. Ended up having her lie down, unloading her, and maybe my own fault here, but this is where I started to go lateral and looking at left rotation, which she tolerated well, lying down and just very gently kind of mobilizing, maybe not mobilizing as much as just passively moving her into left rotation, but she tolerated it well and began to see some improvements taking place there. We'd sit back up and she could definitely get further and further. So that day I ended up going lateral left rotation. And by the end of the visit, she was giving just a little bit of self-overpressure and tolerating that well. So now I'm thinking I've exposed the lateral, be it through that additional force with thoracic extension, or if it was sleep position or what, but she began to reduce with left rotation.
When you say tolerated, do you mean she was in supine? I assume is what you meant. You
Yes.
lied her supine and had her start rotating, just actively rotating?
Actively, I had my hands behind her head, so I'm kind of offloading, assisting a bit. So it's a combination of both. We had attempted maybe just a few repetitions in sitting, and it was just wincing pain, not comfortable. I'm not going to pursue it. I've got her hanging by a thread at this point. So let's try lying down. Let's go here. She was doing much better with that.
Gotcha. Okay. And then she was able to start from a seated position. Then she was tolerating some rotation and sitting, ultimately to where she was giving overpressure.
That's right.
Okay. And are you checking just the left rotation throughout to kind of see where you are?
I am checking more. So that was obviously from previous visits. And then this visit, that was her biggest loss still. So That's kind of top of the list. But yes, looking back at right rotation, that's coming along too. So I kind of look at that as the key that's turning the lock. Oftentimes you'll see those other movements improving, but you always have to look. So about every other time we perform movements, I'd look back at right rotation. I'd look back at just her ability to extend and retract. Those were all restoring.
Got it. Okay. Yeah. Where'd you go from there?
Left her with the left rotation. I had her come back 4 days later. She's very compliant, very, very careful with posture. This is the point where I felt like I was close to losing her. She said that left rotation was helping, but only for a matter of minutes. So if I do left rotation, I get to end range, but within 5 or 10 minutes, the pain's back, the tightness is back. She's doing them very frequently. She's putting a lot of effort into this. And, this is now starting to fit into some of those things that she did prior to coming to see me. The chiropractic manipulation would help very short term. The massage would help very short term. And
month after month, new guest experts sharing actual patient cases and subscribers sharing their own challenging and interesting cases. Check out Case Conversations at mechanicalcareforum.com.